Hi everyone, it's Dr. Nye and we're going over the Lab 7 handout. So this is the first material that we'll cover after our midterm. And it focuses on the respiratory tract. So as you can see, Dr. Joe and I performed a mid-sagittal section of Jenny over the break. And to just to point out some of the external aspects of the respiratory system, we're looking at the nose, or what is referred to as the rhinus. So here's the nose, rhinus, and essentially the bridge of the nose, okay, would be designated as the dorsum. Okay, so this is the dorsum. I'm going down the list of landmarks on our handout. Next we have the apex. So essentially that's the tip of your nose, okay? And typically we have the alar cartilages, at the apex of the nose. Furthermore, we have the columella, okay? So the columella is quite literally the little column that separates the nares, the openings, okay? So again, now we have reached another term on our handout, the external openings, or the nares, okay, and the ala nasi, okay? So the ala nasi are simply the connective tissue, okay, which really forms like the lateral border of the nostrils. So please keep in mind, again, the nostrils are also referred to as the external nares, okay, and these are simply openings. Now, what I'm going to do is open up Jenny's head here, and we'll just point out some of the structures that are deeper. Okay, so basically what you have here, okay, so this is, obviously, if this is our nose, and I were to put the probe inside the nose, okay, I would be inside the vestibule. So this is one, essentially a space, harbored within the nose, which is on the exterior or external portion, right, of the face. Now, notice, everyone, this will constitute the septum, the nasal septum. So there is a cartilaginous septum, as you can recognize right here, okay? And then of course, there is the bony septum, and that is comprised of your nasal bones, okay, as well as the septum itself would be actually the perpendicular plate of the ethmoid bone and the vomer, okay, so that would be the bony septum. But otherwise, it is also comprised of cartilage. So here's the cartilage. And again, just pointing out some of the distinguishing features, we would have the superior, the middle, and the inferior nasal conchae, okay? And then the spaces between the conchae would be a meatus, okay? So there's a superior, middle, and inferior meatus. So if you recall, the inferior nasal concha would be the one that contains erectile tissue, okay? And if you recall, we also refer to that as the swell body, right? So that tissue becomes engorged with, essentially with blood, with venous blood, and this side of the nostril would basically be occluded, okay? So this side of the nostril would be occluded, and the airflow would go through the other side when in fact that tissue is engorged. Okay, so again, that happens every 30 to 60 minutes, so once to twice during the course of an hour, the airflow shifts, okay? So it is predominantly on one side at, a given time versus the other, okay? Now, certain things to point out here. Now keep in mind, we did remove the really the larynx, okay, and the trachea. So we'll identify some of those features in a little bit, but I did want to point out, okay, if I go to this side of the cadaver, this would be the opening. Wait a second here. Right here. So again, this would be the opening into the eustachian tube, okay? So what you see here is a little pillow-shaped structure called the torus tubarius. Now, I'm going to try to, again, point it out over here as well. So in the nasopharynx, and this is the region of the pharynx, the throat, that is going to be posterior to the nasal conchae. So again, here is my eustachian tube, okay? So can you see, as I've inserted the probe in the eustachian tube, that is where essentially the ear would drain into the pharynx or the throat. And again, this region right here would be my nasopharynx. So here's my nasopharynx where the eustachian tube is. And again, the pillow-like feature protecting, let's say, particulate matter from entering into the eustachian tube, this is called the torus tubarius. Okay. Now, just looking at the other structures on my list. So, I'll tell you what. Sorry. Let me do this. Okay. So, what we're going to do is we're going to look at the larynx. All right. And actually, before I look at this specimen, okay, just to be a little bit more helpful, we're going to look at this model, okay? So just to identify some of the, prominent features in the larynx. So just to orient you, this is the hyoid bone. And if you recall, the hyoid bone does not articulate with any other bones in the body. So it's actually articulating with the thyroid cartilage. So here's my thyroid cartilage, right? My epiglottis, which is essentially elastic cartilage, and then my cricoid cartilage. So these are the 1, 2, 3 major cartilages of the larynx or the voice box. Okay, so again, this is my larynx right here. There are paired cartilages also. So there are arytenoid, cuneiforms, and corniculate cartilages. Okay, so there are 3 paired cartilages. What these little structures are supposed to represent would be the vocal cords. And really what you would have over here in this space would be vestibular folds, okay? Now, please recognize that this structure below my larynx would be the trachea. Okay, so again, this is the trachea, and if you're looking at the posterior view of the trachea, there would actually be the presence of what we call the trachealis muscle. So the trachea usually has these C-ringed cartilages, and you can see that is part of our model, and again, posterior would be the trachealis muscle. So those C-ring cartilages do not go completely around, right? You would have the trachealis muscle in the back. So this whole larynx is perched on top of the trachea. This is the trachea, and again, this structure right here is the larynx or the voice box. I mean, granted, we call it the voice box, but the main presence of this structure is to simply prevent food from entering the trachea, okay? So really that will be accomplished by the epiglottis. When you swallow, the root of the tongue forces the epiglottis down over the glottis, the opening in the trachea. Also, these vestibular folds, okay, which again are lacking in my model here. It's the space on either side of the vocal cords. They will completely close along with the vocal cords. So this again would be the space, that the entryway into the trachea, and that will be closed when we swallow. We don't want food, liquid, any matter to enter into the trachea or windpipe. Okay, and now I will show you some of the features on Jenny. So, if I can just put some light over here. All right, so you can see that the trachea has these C-ringed cartilages, right? And again, I'm going to go to the posterior aspect, and what's really neat is, look at this. You can observe the trachealis muscle. So the trachea, if you recall, sits in front of the epiglottis, and that way, when you're swallowing food and the epiglottis, let's say, expands, you're not going to be prevented from breathing. Okay, so again, it allows for the epiglottis to move into this region, and again, you can continue breathing. So that's a very valuable feature. Now, what you're looking at, okay, this is the tongue, and once again, this would be the pharynx or the throat, okay, and we can see the epiglottis here. Okay, here's the epiglottis, and when you swallow, the tongue forces the epiglottis down over the opening or glottis of the trachea. Again, I don't know if it's going to be rather hard to see, but it's very interesting. You can, in fact, observe the glottis or opening in the vocal cords and the vestibular folds on either side. I suppose I'll have to show you that in some PowerPoint slides, but regardless, we'll try to use Jenny when and where we can. Okay, so if we concentrate, if we move our focus to the lungs, all right? Let me see. I just want to orient these, my specimen as best as I can. So, let me do this. So I'm going to move my heart and lungs, okay, and trachea right over here. Now, again, what I will emphasize would be, okay, that my lungs, all right, hold on, everyone, okay. So the lungs as they sit in Jenny's chest, my right lung has 3 lobes, a superior, a middle, and an inferior lobe, okay? And basically separating the superior and middle lobe would be what we call the horizontal fissure. And then the space separating the middle and inferior lobe would be the oblique fissure, okay? And my left lung has 2 lobes, okay? So there's a superior and an inferior lobe, and there's an oblique fissure, okay? So again, the right lobe has 3 lobes, the right lung has 3 lobes, the left lung has 2 lobes. Now, if you consider, again, some general anatomical features of the lungs, I would say that, just at the top portion of the lungs, we typically denote this region as the apex of the lungs. And then these flatter, more concave regions of the lungs that sit atop the, if you look over here, of the diaphragm, this would be these regions would be like the base of the lung. So base and apex, all right? Now, I'm going to turn over the lungs, okay, because I want to try to get a posterior view here, okay? And again, to talk about some of these defining features. So, again, if this is my, let me see here, okay, right? So if this is my left lung and my right lung, okay, let me just point out that the right lung, okay, and again, we're going to be really looking at the airways here. So if this is my trachea with my trachealis muscle, at where the trachea forks, okay, into basically the two main bronchi. So again, my right and my left main bronchi. All right, right along here, if we were able to look inside the trachea, there's a ridge called the carina, okay? And the carina is like quite literally a little ridge that can direct airflow into either the right or the left major bronchus, okay? And people, if you are subject, unfortunately, to choking on something or having something lodged in your airway, typically that is observed, I'm sorry here, that would be observed, and if you can recognize it here, I'm sorry if I was referencing this incorrectly. I turned it on the posterior side, so obviously you guys, this is my right lung and my left lung, and if you notice the two major bronchi, the right bronchus here is wider and really it sits more vertical, okay? So typically you would end up getting something lodged into the right main bronchus. If you look at the left main bronchus, it's typically it's thinner, okay, so it's not as wide, and it sits more horizontal. So again, the right main bronchus being wider, and again, more vertical. Typically, food gets lodged in the airway at this point, okay? Again, if it makes it into the trachea and into the main bronchi. Now, if we were to further look at the airways, okay, or the conducting path, if you will, of the lungs, then the right main bronchus would divide into, because again we have three lobes, it would divide into three secondary lobes, okay? So essentially, you guys, you would have the right main bronchus and three secondary bronchi, okay? So the secondary bronchi are also called the lobar bronchi, and I can feel them or I can palpate them. Okay, so again, I have three lobes, and thus the right main bronchus would divide into three secondary or lobar bronchi. Now, within each of these lobes, then the lobar bronchi or secondary bronchi branch into what we call segmental or tertiary bronchi. Okay, so once again, you guys, if we come over here to the to my left lung, all right, so if we come to the left lung, it has two lobes, and thus the left main bronchus would divide into two secondary or lobar bronchi, okay, so I can feel the division of the two bronchi. And then those two bronchi further divide into segmental or tertiary bronchi, okay? And then we'll go through the rest of the bronchial tree, so to speak, when we meet for our laboratory lecture time, okay? So we'll discuss the aspects of that. And I believe that is all I will show you, okay, relative to Jenny and our specimen, okay? So I'll see you on Tuesday. Thanks.